A high-performing team achieves specific performance metrics, including a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest resuscitation attempt. You can only achieve a high CCF by eliminating pauses during high-quality CPR.
The Resuscitation Outcomes Consortium trials, or ROC trials, showed that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest and be prepared to resume compressions.
As a BLS provider, you may notice that advanced providers check for a pulse, pre-charge the defibrillator, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle. When using an AED, the prompts will instruct you when to pause, for example, during rhythm analysis or shock delivery.
Switch compressors with the second compressor coming in from behind the first. This allows the second compressor to have the same view of the team, and in particular, of the AED or defibrillator. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible, such as while delivering breaths.
3, 2, 1, switch.
It's a best practice to use real-time feedback devices during CPR. However, if a feedback device isn't available, a metronome can help establish the proper rate. If your AED or defibrillator doesn't have a metronome, you can download a metronome app to your mobile device before the conclusion of this course.
It's not enough to know what to do or even how to do it. To obtain the best results, your team must perform both the what and the how flawlessly. That requires practice, and effective practice requires measurement. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Again, you cannot improve what you do not measure. For more information on how your team can implement this type of program, talk to your instructor.